Also, as part of the axial skeleton, we have the thoracic cage. Making up the thoracic cage, we have ribs and the sternum. The sternum is what we usually know as breastbone. We have 12 pairs of ribs, exactly the same number as the number we have for thoracic vertebrae, because our ribs click into the thoracic vertebrae. We have vertebrosternal ribs, we have vertebrochondral ribs, and we have vertebral ribs. All ribs are flat bones. They are either flat horizontally or flat vertically. They are flat bones. And I will show you exactly what I mean by that when we go over the different types of ribs in the lab. When we look at the anterior view of the thoracic cage, we can see the 12 pairs of ribs. We have 7 pairs that are vertebrosternal ribs. We have 2 pairs that are vertebral ribs, and we have 3 pairs that are vertebrochondral ribs. The way I do to remember the number of each type of ribs is by remembering that the top ones, which are the vertebrosternal ribs, are the same number as the top vertebrae, which is the cervical vertebrae. And I told you 7 cervical. And then I remember that the vertebral ribs are the floating ribs. And we only have 2 pairs of vertebral ribs, and they are called floating ribs because they do not articulate with a cartilage that goes towards the sternum. So they are floating. And because they're floating, they have this pointy end. And if you go ahead and you press your fingers in the posterior inferior aspect of your thoracic cage, and you press it deeply, you might be able to feel these endings of the vertebral ribs. Now, based on math, we only have 3 pairs of vertebrochondral ribs left. We talked before about the root chondrule. Do you remember what the root chondrule means? That means cartilage. Now let's look at this image right here and focus on ribs 6 and 7, which are vertebrosternal ribs. Can you notice that ribs 6 and 7 connect to a piece of cartilage that connects to the sternum? You see? They end and they connect with a piece of cartilage that connects to the sternum. Now let's look at the vertebrochondral ribs that we are seeing right here, ribs 8, 9, and 10. Can you notice that these 3 pairs of ribs, they connect to a cartilage that connects to the other cartilage right here that goes towards the sternum? You see that? So the vertebrochondral ribs are the ribs that have an extra piece of cartilage that takes to the other cartilage that connects to the sternum. And that's why they were called vertebrochondral, making a reference to this extra piece of cartilage that is found before they can connect to the sternum. And because of this extra piece of cartilage, they are called false ribs. They are not directly attaching to the cartilage that's connecting to the sternum. They are false. And guess what? The true ribs are the ribs that attach to a cartilage that goes directly to the sternum. So we have true ribs as ribs 1 to 7. Vertebrosternal ribs are true ribs. Ribs 8, 9, and 10, so 8 to 10, are false ribs. Those are the vertebrochondral ribs. And ribs 11 and 12 are floating ribs, which are specifically the vertebral ribs. Now, all the cartilage that we are talking about that connects the ribs to the sternum is hyaline cartilage. Now, let's focus in the sternum. The sternum is divided into 3 main parts. We have the manubrium, the body, and the xiphoid process. The manubrium, it looks like a letter M, so it's very easy to remember. The body is the longest part of the sternum, and then we have the xiphoid process. In the superior aspect of the sternum, specifically in the upper surface of the manubrium, we find a notch. How do you think a notch in the superior aspect of the sternum was named? It was named suprasternal notch, also called jugular notch. And if you go ahead and you pass your finger in the top part of your sternum, you can really feel your jugular notch. Also in the manubrium, we find another notch that articulates with the clavicle. And consequently, since this notch of the manubrium will articulate with the clavicle, that was named clavicular notch of the sternum. When we look at the junction of the manubrium with the body of the sternum, we notice that that junction is not flat. And because it is not flat, we can really feel it if we pass our fingers on top of our sternum. And since that is not flat, that is in an angle. And that's why it was named sternal angle, the angle of the sternum. Now, the identification of the sternal angle by palpation is very important because the second pair of ribs attach at the sternal angle. So the sternal angle serves as a clinical landmark for health professionals to identify where the second pair of ribs are located and then count and identify all the other pairs of ribs that are lower correctly. And with this, we finish the axial skeleton lecture. Please let me know if you have any questions, and I will see you in class. Bye!